Hello class, I'm Ken Bailey and I'm here to tell you about the Tinetti assessment. This Tinetti assessment is also called Performance-Oriented Mobility Assessment. It was created by Mary Tinetti. It is an exam that has been used as one of the earliest measures to assess balance and gait. It has a better test, retest component than other exams such as timed up and go. Specifically, it is used to assess static balance and dynamic balance in two different components. The static balance would be seated in a chair or standing upright, and there is also a gait assessment, which would be the dynamic portion of the exam.
Hi, I'm Mary Tinetti. So three populations who the Tinetti balance test would be administered to could be stroke victims, individuals with ALS, and geriatric patients. These populations share the potential for having impaired balance or loss of mobility, whether sudden or progressive. Using the Tinetti test helps care providers determine if these individuals merit a fall risk and what precautions and interventions would best serve to ensure their safety from fall-related injuries.
My name is Eric Rawl, and I'm going over the scoring for the Tinetti test. The Tinetti test is scored on 3 different points, from 0 to 2. 0 is the lowest, and 2 is the highest. A patient with a score of 0 shows the most impairment, and someone with a score of 2 shows the most independence. For example, if someone can't get out of the chair without any help, they get a score of 0. Someone who is able to get out of the chair without using the arms of the chair gets a 2. The individual scores are then combined to form 3 different measures: overall gait, overall balance, and gait plus balance. The maximum score for the gait component is 12 points, and the maximum component for the balance is 16 points. Then combined, the highest score is 28. In general, patients who score 0 through 19 are at the highest risk for falls, and people from the scores of 19 through 24 are at risk for falls.
I'm Zachary Sievers, and I'm going to be the examiner today.
I'm Nicholas McBurnett. I'm going to be the patient for today.
Okay, so can I have you walk down to that chair and then back for me, please? Okay, because he had no hesitancy, I would give him the best possible score of 1. His right foot passed his left stance foot, he would get a 1 for that. His right foot completely cleared the floor, so I'd give him a 1 for that. His left foot did the same. It passed the right stance foot, and his left foot completely cleared the floor, so I'd give him, for that assessment, I'd give him a complete 4. Can I have you do it again for me, please? Okay, his right and left step appeared to be equal, so he got a full point for that. His steps appeared continuous, he just kept moving, that was a 1. He walked straight without any walking aids, that's worth 2 points. He had no sway, no flexion, no use of arms, and no use of walking aids, so he gets 2 for that. His heels were almost touching while he was walking, so he got a 1 for that. So he got a gait score of a perfect score of 12 points.
Hi, my name's Colin, and today we're doing the balance portion of the Tinetti test. This is my geriatrics patient.
I'm Ryan.
I need you to stand up. Okay, so you were leaning in your chair at first. That earns you a score of 0. You were able to get up, but you had to use the chair to help you up, so that's a 1. You were able to get up your second try, which is a 1. You are not standing balance right now, so that's a 0. Next, I'm going to do the nudge on your sternum. Okay, so you didn't fall completely, so that's a 1. Next, I need you to close your eyes. That's a 0 because you did not maintain your balance. Next, turn 360 degrees. earned a 0 for the 360-degree turn because you were unsteady. Lastly, I need you to sit down. Oh, you good? Okay, that's a 0. So he earned 3 points, which is well below 19, and so he's at greater risk for falls.